Chicago Tonight, Latino Voices is made possible in part by CIBC and by the support of these donors.
Good evening and bienvenidos to Chicago Tonight, Latino Voices. I'm Hugo Balta, WTTW News Director and your host. Thank you for sharing part of your weekend with us. On the show tonight, communication with your healthcare provider is crucial for good outcomes, but what happens when you don't speak the same language? Two local doctors explain what your rights are. Working 12-hour shifts and going to school. A ProPublica report finds immigrant teens as young as 13 years old are illegally employed in suburban factories. Reporter Melissa Sanchez joins us with the details. Vamos a celebrar que ya llegó la Navidad. We'll make a holiday toast with the traditional Puerto Rican drink, coquito.
Necesitamos un poquito de entusiasmo navideño.
And lifting spirits and helping residents. How a Pilsen Holiday Window Walk aims to support small businesses and local artists. First off tonight, when you're having health problems, clear communication with healthcare providers is crucial to understanding treatment. And while medical jargon can seem like its own language, for the estimated 25 million people in the United States with limited English proficiency, finding healthcare that speaks their language is even tougher. Joining us to talk about breaking through language barriers in medicine are Dr. Jonathan Moreira, hematologist, oncologist, and assistant professor of medicine at Northwestern University Feinberg School of Medicine, and Dr. Pilar Ortega, board-certified emergency physician, a medical educator focusing on medical Spanish, and a researcher on physician communication in non-English languages at University of Illinois Chicago Medicine. Welcome to both of you. Dr. Ortega, let's start with you. Why is language concordance so important in healthcare?
Absolutely. Well, first of all, thank you for inviting me to this extremely important conversation. Language concordance means that the patient and the clinician or provider speak the same language. The reason it is so very important is that we actually have research showing that it actually affects patient outcomes. You, in other words, can have better clinical outcomes, for example, better blood sugar control if you have diabetes, if your doctor speaks the same language as you. So we're not talking just about it feels good to have a doctor who speaks your language, which is true. It also makes an impact in your health.
Communication is, of course, very clear and important in those situations. Dr. Moreira, what are providers doing now when they don't speak the patient's language?
Well, there are a variety of resources that can be used. Language line services using a landline phone or even a mobile phone can be utilized. More contemporary technological solutions include tablets that are mobile, can be readily used in the inpatient and outpatient setting. And of course, using in-person live interpreters that are physically present in the room that can also pick up on nonverbal cues and body language.
The COVID vaccine is being administered this week. One of the first persons was Dr. Marina Del Rios here in Chicago. Here's a little of what she had to say.
As we say in Spanish, hacemos de tripas corazón. We mend hearts out of guts. This vaccine gives us some hope that there is an end point. There is a light at the end of the tunnel.
Dr. Ortega, do you think language concordance in healthcare would improve vaccine uptake among Latinos who are distrustful of the vaccine?
Absolutely. Communication in times of a public health emergency, such as we have seen during the COVID-19 pandemic, really has magnified health disparities for non-English speakers in the U.S. And this is precisely the reason. If we don't receive the information in our language, or at least we don't receive it in a timely fashion, oftentimes information gets translated from English and it takes a considerable amount of time for it to be available in non-English languages. And as a result, those populations are not necessarily having access to the same trustworthy information from public health authorities as the English-speaking population is. And so absolutely this feeds into the distrust because there is truly a lack of information. And as a result, it may also allow other sources of misinformation and disinformation to play a larger role in those communities due to the lack of other sources of information. So having physicians actually and other health professionals, health departments communicate with patients in their language in a timely fashion, especially in cases like this, will certainly have an impact on uptake of the vaccine.
Communication is key, knowing the language is key. But Dr. Moreira, beyond language, how can gaps in cultural fluency affect the care of patients?
Well, I think that can adversely impact care of patients when there's a chasm in cultural understanding. And this is why it's so important to recruit physicians that come from varied cultural backgrounds that reflect the diversity of the makeup of the communities that they serve. There might be misunderstandings as to how patients or community members might perceive medicines such as antibiotics or the belief in alternative remedies, or in my own field as an oncologist, the role of chemotherapy and the perception of side effects as well. So this is something that we really have to have a significant understanding of the cultural nuances and values and perspectives that our patients have. And there is one of the most effective ways of doing that is to recruit physicians and healthcare professionals that reflect that cultural diversity.
Dr. Ortega, have you found healthcare providers or institutions reluctant to address the language gap? What objections, if any, have you encountered?
Well, there are a number of objections that oftentimes come up. For the most part, I have to say healthcare professionals and healthcare institutions really do want to take care of patients. I mean, that is the bottom line for everybody. But there are systemic obstacles and structural barriers that get in the way, especially for individuals who have different language needs and preferences. And so some examples are cost. The reality is that it does cost money to provide interpreter services. It costs money to teach or train your staff to work with interpreters. It costs money to teach or train your staff to learn another language. A lot of physicians and medical students are interested in refining, improving, enhancing the second language skills that they have in Spanish or in other languages because they see that it would be a benefit to them to be able to better communicate with their patients. But all of those things take resources. So that is definitely one of the biggest obstacles. And the other one that I see all the time is time. Physicians want to do their very best for patients. Clinicians want to do their very best for patients. But when it comes down to, you have a bunch of patients in the waiting room, for example, in my line of work in the emergency department, sometimes it's really hard to take those extra 5, 10, 15 minutes that it may take to work with an interpreter, even when people know that that is the best practice in order to give the patient the best quality of care. Time is really against us a lot of the time in clinics as well, when you might have 8 minutes or a short amount of time to be with a patient, and you know that's going to be doubled in the case of a patient who with whom you have a language discordance.
Yeah, time and those translating services are so crucial. I remember, being a 10-year-old and being that interpreter for my mother and my father. So it's good to see that a lot of more health providers are providing those professional services because, of course, in immigrant homes, you can't have the children translating adult conversations, especially when it comes to healthcare topics that are so serious. Unfortunately, that's all the time we have for now. Our thanks to Drs. Moreira and Ortega for their time and insights.
Our pleasure. My pleasure. Thank you very much for having me.
Thank you so much for the invitation.
Now to Phil Ponce and the story of some young immigrants potentially being put in harm's way in a conversation that was recorded earlier.
It's common knowledge that many factories in the area employ immigrants to do all sorts of work, from baking pastries to cleaning bolts. But a November report by the nonprofit publication ProPublica found that some of these immigrant workers are only 13, 14, and 15 years old. These children sometimes perform hard and dangerous jobs against the law and often work overnight shifts and go to school during the day. Joining us to talk about her report is ProPublica reporter Melissa Sanchez. Melissa, thank you for joining us. And first of all, give us some background on who these young people are.
Sure. So I wrote about a group of young people who live in Bensonville, so a suburb just near the airport, near O'Hare, who came in recent years from Guatemala. So they've come as part of the wave of hundreds of thousands of Central Americans who've crossed the border in recent years. And these are kids who came, a lot of them as unaccompanied minors. Some of them came with parents or other adult relatives, and they wound up settling in Bensonville. They attend high school in nearby Elmhurst at York Community High School, and attend school during the day, and then at night work in factories to pay off debts and to send money home to family.
And a little bit more on why they work. You mentioned pay off debts, but these young people you talk to about 15 of them, are very motivated. Why are they so motivated?
Yeah, I mean, so they left Guatemala for a lot of reasons. I mean, some of it's economic, some of it is to escape gangs, etc. But what they have in common is that they all come from very poor families, and to come to this country isn't free. They all came seeking asylum, so they're here with some sort of status. But the trek from Guatemala to Mexico is very dangerous, and you have to pay a human smuggler, a coyote, to bring you here. And those fees can range from a few thousand to, I've heard, $10,000 per person. And so the kids, when they come, again, alone or with some relative, they know that they will be responsible for paying off that debt upon their arrival here. And they have to pay that debt because their families back home can't afford it. So that's the big debt that they have. But then depending on their circumstances here, they might owe money to a sponsor who took them out of the shelter where they might have stayed for a few weeks or months when they arrived. They have to pay their share of the rent. They have to pay for their clothing, their food. And then because they do have relatives back home who are in financial need, nearly all of them send money home to their families, to their parents or siblings who they left behind.
So these some of these young workers are as young as 13 years old, you pointed out. How are they able to get jobs? It's against the law to hire people for the kind of work that they do and for the hours they put in. How does that happen?
Yeah, it's really complicated, but I mean, like you said at the start, so a lot of the factory jobs are filled by immigrants. A lot of the immigrants are here without legal status, so they're undocumented. But it's pretty well established in Chicago that if you want work, there's temp agencies that are willing to hire you regardless of status. You might have fake papers. So the same applies to these kids. The youngest I spoke with started working at age 13 in an overnight shift at a factory. And he had, like all the rest of them, had a fake ID that said that he was over 20. And when you look at these kids, they look like they're 13 or 12. They look very young. They don't look 20 or 25 like their IDs say. But they take these IDs to temp agencies that accept them and then put them to work in different factories across the suburbs.
So it's the temp agencies that hire them, not the factories themselves. But you pointed out one case of a 15-year-old who was going to school and he was working 6 12-hour overnight shifts a week. How do they do that and go to school?
I don't know, and they don't do it very well. I mean, so that boy, like all of them, they show up to school very exhausted. The reason they're going to school is because they want to stay in this country. They have pending asylum cases, and immigration court judges want to hear that they're in school, not working. So they go to school, but they show up and they just pass out in class. They chug energy drinks and coffee like adults. And then when they go to work, they're still tired. I mean, they might sleep for a couple of hours in between work and school or in between school and work, but they're still exhausted when they show up at work, which might make it easier for them to get hurt, to slip up on the job and to have an accident.
You mentioned, I mentioned that according to the article, you spoke to 15 young people. How widespread would you say this is?
I think it's really widespread. There's not going to be any numbers to show that, but we know that in the past 5 or 6 years, there have been hundreds of thousands of young people from Central America who've come. And I've spoken to people all over the country, educators, labor advocates, others who know that in communities where there's large numbers of Guatemalans, Salvadorans, Hondurans, that there's a lot of young people who, like the kids in Bensonville, came here with debt and they ended up working. So I spoke with folks in Cincinnati, in New Bedford, Massachusetts, and New Orleans, and Southern California, where there's large communities of these kids. And they're working either in fish packing and in roofing. Even in Urbana-Champaign, there's a large community of indigenous Guatemalans who work in roofing and in restaurants. So I wish I had a number to put it, but even after we published the story, I heard from educators all over the country that it's happening in their schools too.
Any prospect of a crackdown on the people who are facilitating what is illegal employment?
Not at the moment. So the State Department of Labor is very interested in knowing where these kids work and doing some sort of enforcement action. But it's complicated because, I mean, for these 15 kids, they work at least 25, 26 different facilities through at least 4 different temp agencies. It's not one bad actor that's doing it. It's very widespread. So at the moment, I haven't heard of any specific actions that the state is taking. At the same time, these kids don't want it to be known where they work because they want to continue working. So it makes it difficult for the enforcement agencies to do anything about it when nobody is telling them where these kids are working.
Melissa Sanchez, thank you so much. A very engaging piece. Thank you.
Thank you.
And Hugo is back with more Chicago Tonight Latino Voices in just a moment, so please stay with us.
It's been very difficult for small businesses to stay afloat during COVID-19 restrictions. A nonprofit on Chicago's Lower West Side is getting creative this holiday season with an initiative designed to boost businesses and support local artists.
Just to bring a little holiday cheer.
This winter, Pilsen's iconic 18th Street is finding new ways to get into the holiday spirit. Small businesses are partnering with local artists, bringing festive window displays to the neighborhood.
Es que necesitamos un poquito de entusiasmo navideño.
The initiative is also a healthy competition, says Alex Esparza, president of the Economic Strategies Development Corporation, a nonprofit in Pilsen. Residents can vote for their favorite displays online. The winning artist will receive $1,000.
It was the Macy's or the Marshall on State Street kind of idea of families coming out and visualizing this window displays.
The 2020 Christmas Window Walk is both an opportunity for local artists to showcase their work and to increase foot traffic on 18th Street, Pilsen's commercial corridor, which Esparza says has significantly seen a decrease throughout the pandemic. The initiative is welcome help during a challenging time, says Pilsen artist LETICIA RODARTE.
It's been difficult. It's been very difficult because under normal circumstances, artists have a hard time selling their art. But now during the pandemic, it's even worse.
RODARTE created the window display at Cafe Jumping Bean. She used recycled items like corn leaves to recreate a Christmas moment from her childhood. She hopes it reminds residents passing by of their own families.
Especially the Latinos that are familiar with the scenario, they're like, oh, I remember when I was a child. Oh my God, my grandmother's tortillas and my grandmother's this. So it makes them happy. It's a moment that amongst all the chaos makes them happy.
Throughout the pandemic, some organizations have pivoted to drive-through events, but Pilsen's window displays are detailed, requiring them to be viewed up close. It's really meant to be seen in person right outside the window. Can you tell us a little bit more about that specific strategy?
So, I mean, it's very easy to be able to drive through a neighborhood because you can go through a neighborhood in 5 minutes. But that doesn't really necessarily generate anything outside of just traffic.
Esparza hopes the intricate displays will bring more business to the community. That was Stephanie Seasonton's goal when she designed a storefront of Mexican gift shop Escaramuza.
It allowed me to not only continue to be creative, but also help the community. I'm hoping that this was able to help Julio bring in more business and visibility to his wonderful gift shop here.
Escaramuza owner Julio Velázquez says so far it has.
So, sí ha ayudado. La gente se para enfrente de la decoración, se toma fotografías. Durante el fin de semana hemos notado eso. que a la gente le atrae. O sea, sí ha tenido un impacto positivo para el negocio.
That's also true for RODARTE's display at Cafe Jumping Bean, says owner Eliezer Delgado. And he says the full Christmas walk has helped lift the spirits of residents passing by.
I see the people, stopping by, taking pictures of it and checking in on social media with it. So that's been nice. So, it's, and I see it up and down 18th Street. It's not just our location. I see it at the other spots that have it. The artwork and the windows have definitely done, a little bit to help, with the mood of people.
Voting ends this Monday, though you can catch the decorations through January 3rd on 18th and surrounding streets. Now to Brandis Friedman and what's on tap for tomorrow.
Ugo, we've got a great show planned tomorrow. We'll talk about getting into and attending college in 2021 under the effects of the pandemic. Plus, Mercy Hospital may be staying open a bit longer and remembering victims of gun violence this holiday season. That's tomorrow night at 6 on Chicago Tonight, Black Voices. Now, Ugo, back to you.
Thanks, Brandis. 'Tis the season for coquito. The delicious coconut drink is a treasured tradition for Puerto Ricans at this time of the year. In tonight's Sabor Latino Chicago, I share a toast with comedian and producer Mike Oquendo, who teaches us how to whip up our own batch at home. Plus, we'll learn how La Isla del Encanto celebrates Christmas. Mike, más que nada, thank you very much for inviting us to your lovely kitchen. We're here to talk about a tradition, a staple of Puerto Rico, el coquito, very popular, of course, during the holidays, especially Christmas. Tell us about el coquito.
Bienvenido, Hugo. Bueno, coquito is a traditional Puerto Rican drink typically found around the holidays. Some may call it the Puerto Rican eggnog. Most of the ingredients can be found at your local store. It's really simple. It's fun to make. You can make it with and without alcohol. And it's just something that is in every home right around from the beginning of Thanksgiving all the way through Nochebuena. My mother recalls a time before she came here from Puerto Rico to the United States where they would actually guayar el coco, to grade the coco, to make it in its original form. Here, when she came here, it was just much easier to get a can of this and a can of that and a can of this and then put it together.
Let's get to it. The original recipe. ¿Cómo hacemos el coquito?
Let's go. Bueno, we're going to start with 1 cup or 1 can of evaporated milk. 1 can of evaporated milk. And there's a lot of different cans on the market, and some people prefer one or the other. That really isn't that important. Crema de coco. Crema de coco, not to be mistaken for coconut milk. 1 can of crema de coco, just like that. And I like to get all the good stuff in there because it's all really, really good, rich coconut. There you go. And 1 can of coconut milk. The mother of the batch, the can of condensed milk, all right? And the condensed milk is very, very thick, so you're gonna have to obviously grab something to get the good stuff out of there with. 1 teaspoon of cinnamon and 1 teaspoon of nutmeg, all right? Just like that. And then, of course, our traditional Puerto Rican rum. There are many options at the store, but 1 cup of Puerto Rican rum.
Fantastic. Let's taste it.
Absolutely. All right. This is just a taste test to see where you ended up, but ultimately you want to refrigerate it.
Muchas gracias. A ver.
Buen provecho.
Me quito la máscara para probarlo. Salud. Buenísimo. Buenísimo. This is delicious. Now, this is not just a passion of yours for the holidays. It's not just a family tradition, but it's also about charity. Please tell us about your work with La Casa Norte.
We have an annual fundraiser that typically is a live event where people attend. We were not able to do an event this year. We were thinking about how we can help, how we continue to do a fundraising event. And then I thought, well, then I'll make some coquito. We'll make some coquito and we'll sell the coquito and then give them the proceeds. So we were able to make 100 bottles, sell them, and we were able to help them with their program, which houses homeless teens. And La Casa Norte has been doing wonderful work in the city with the homeless for years. And so we were really, really happy that the coquito was able to contribute to helping this year.
Another holiday tradition is El Cuatro. Tell us about how el cuatro, along with el coquito, is part of the holiday tradition in La Isla del Encanto.
Yes, listening to Jennifer interpret the wonderful melodies of Puerto Rico through el cuatro, the parranda music that is often heard in our homes, just really gets the whole mood going. The coquito and the cuatro and the awesome food and the aromas, it just makes all the best for a traditional Puerto Rican Christmas.
Bueno, Mike, Feliz Navidad, próspero año nuevo.
Encantado,
Salud.
igualmente.
It just gets better every time.
It does.
Michael Kendo says there are many flavor variations on coquito these days, and I was able to sample one in his kitchen. Coquito in iced coffee, you gotta try it, delicioso. And that's our show for this Saturday night. Join us next week for more holiday fun, including El Día de los Reyes Magos. In the meantime, be sure to check out our website, wttw.com/news, for the very latest from WTTW News, including details on the state's COVID-19 vaccine rollout. And of course, join Brandon Friedman tomorrow night for Chicago Tonight Black Voices. We leave you now with more holiday windows along 18th Street. Now for all of us here at Chicago Tonight Latino Voices, I'm Hugo Balta. Thank you for sharing part of your weekend with us. Have a healthy and safe holiday. Buenas noches.
Closed captioning is made possible in part by Robert A. Clifford and Clifford Law Offices, wishing all a happy and healthy holiday season.